In HealthWorks, a rare disease changes the shape of a young Dearborn boy's face until Beaumont doctors find a way to fight back. A grade school picture reveals a curious boy with a sweet grin, but Matt Hutzel's parents see something else.
It started as like just a red spot on his cheek.
At the age of 5, it's very subtle, but then becomes very noticeable. On his right side, Matt's face is slowly caving in. He's eventually diagnosed with an autoimmune disease, Parry Romberg morphia, his body attacking the tissue in his face.
They couldn't tell me too much about it because it's so rare. So I just had to keep looking up things and going to different doctors and finding out everything I could.
Unfortunately, it's not reversible. Operation would last 6 hours.
Without a cure, the Hutzels realized surgery is the only option. Beaumont Children's Hospital pediatric plastic surgeon Dr. Chaiyasate is about to painstakingly transplant tissue from Matt's back into his face.
It's a technical and demanding operation. So many things could go wrong.
Are you nervous? Yeah.
After one last kiss from Dad, Matthew is off to the OR for a lengthy surgery. It's called microsurgery, making sure tiny blood vessels connect and keep tissue alive, and creating symmetry with Matt's face. Just days later, I visit Matt in the hospital. Does it hurt to eat or to smile? Does it hurt?
It hurts to smile too much.
Yeah. So I better not tell you any really funny jokes, right?
Right.
He's covered in stitches and smiling despite the pain. Matt hopes after this, strangers will no longer ask,
"What happened to your face?"
In his room, you can hear the sound of a Doppler ultrasound, making sure blood is flowing from his neck to his forehead, feeding that new tissue. After the surgery, what was his reaction?
He just now saw himself today, and it was for a split second. He saw the yellow things in his face, and he turned away. Okay. I think it kind of scared him.
Looks better. Swelling had gone down quite a bit.
Oh, it has a lot.
Right.
2 weeks later, Matt is starting to look like that little boy we first saw grinning in that grade school picture. And now, he's getting stares for a good reason.
My dad's always staring at my face.
His dad keeps staring at his face and saying, "I'm sorry I'm staring, but you just look amazing."
And the doctor tells us with the new tissue in place, the disease should not return. Now, part of the work Dr. Chaiyasate does at Beaumont is supported by Children's Miracle Network. So when you donate to CMN, you're helping kids like Matthew. That's HealthWorks. I'm Dina Santafanti.